Coronavirus cases are rising across the whole of Wales. In a short number of weeks, 3 small clusters of cases of the new Delta variant have multiplied rapidly. Yesterday alone, over 1,000 new cases of coronavirus were reported across Wales. This fast-moving variant is in every part of our country and spreading quickly. It is the dominant form of the virus in Wales, just as it has become the dominant form in the United Kingdom and in many other countries in Europe. There can be no doubt but that we are experiencing the anticipated third wave of this pandemic, with the rate in Wales rising overnight to 145 cases per 100,000 people. In a moment, I will set out some reasons for greater optimism in dealing with this third wave than either of its predecessors. But I want to leave members in no doubt at all that community prevalence on this scale brings with it a set of real dangers that no responsible government or Senedd should ignore. Our technical advisory group now says that the prevalence of infection in Wales will remain extremely high for at least the rest of this summer. That level of circulation of the virus will increase the risk of new variants emerging, increase the risk of the virus re-entering hospitals, care homes and other closed settings. It will increase the risk that the virus will move from younger to older people, repeating the pattern of both waves 1 and 2. It will increase the number of people suffering from long COVID. It will increase workforce absences, including in our key public services. And it will place greater strain on our Test, Trace, Protect service and the genomic sequencing service, making the identification of new variants more difficult. What then, Llywydd, are the countervailing factors? Well, first and foremost, vaccination, and particularly our high rates of vaccination in Wales, is changing our relationship with the virus, and doing so faster than any other UK nation. Today, more than 73% of all adults in Wales have received 2 doses of the vaccine. The figure in England and Scotland is 66%, and it is 65% in Northern Ireland. The rising tide of cases has not translated into higher rates of serious illnesses, hospital admissions and deaths in the same way it did during the first wave or in the winter, and that is because of vaccination. I want to put on record again my thanks to all those people who have worked so hard to plan and run this highly successful programme. The second way in which the position is more promising in this third wave is the way we have lived, and that has left some positive legacy. The ONS weekly estimate states that of all the 4 home nations, Wales has the highest level of acquired immunity, and that now stands at 92% of the whole population. Thirdly, we have the defence of the TTP system. In the week ending the 3rd of July, 95% of index cases eligible for follow-up were contacted within 24 hours, and 93% of their contacts were traced. Llywydd, that is the context in which the Cabinet has completed our 3-weekly review of coronavirus restrictions. Our assessment is that taking all these factors, negative and positive, together, we can now proceed to a full Level 1 set of regulations. And this means that from the 17th of July, from Saturday, up to 6 people will be able to meet indoors in private homes and holiday accommodation. Organised indoor events for up to 1,000 people seated or 200 people standing will be able to take place following a risk assessment, and that ice rinks will be able to reopen. And we believe we can go a step further as we move to the new alert level 0, and that we will be able to introduce alert level 0 levels of restrictions for outdoor events and gatherings also from the 17th of July. We will therefore remove the limits on the number of people who can gather outdoors. Outdoor premises and events will have more flexibility around physical distancing. This will continue, though, to be one of the mitigations to be considered in carrying out and implementing risk assessments. We are able to do this because of our long-standing conclusion that the risk of transmission outdoors is much lower than indoors, and because we need to take advantage of the summer period. At the same time, from the 17th of July, the regulations will also change to allow up to 30 people from organisations such as the Urdd, Brownies or Scouts to attend residential centres over the summer holidays. So today we are also publishing an updated version of our coronavirus control plan, which sets out more broadly how we can move beyond the current alert level 1 to a new alert level 0. The Cabinet's intention is that Wales should move to alert level 0 on the 7th of August, provided the public health position in 3 weeks' time still allows us to do so. And I emphasise today, as I always do, the importance of that proviso. In a position where public health challenges remain so volatile, we will assess and reassess the position on the 7th of August, but with the intention that Wales should move to alert level 0, provided the public health position remains as it is today. At alert level 0, we have focused on retaining those restrictions which help people to keep safe, but have the smallest detrimental effect on their wider physical and emotional health. At level 0, therefore, there will be no legal limits on the number of people who can meet others, including in private homes, public places or at events. And at alert level 0, all businesses and premises will be open. Llywydd life will have returned very substantially to how it was before the coronavirus pandemic began. But here in Wales, we will not abandon all those measures which have done so much to keep us all safe. At alert level 0, and from the 7th of August, therefore, people should continue to work from home wherever possible. Where a return to the workplace is necessary, we will continue to ensure that COVID risk assessments will be a legal requirement for businesses, employers and event organisers. It will be a legal requirement that these assessments are drawn up with the involvement of employees, and the mitigating measures set out in those risk assessments must be implemented. In Wales as well, Llywydd, at alert level 0, face coverings will continue to be a legal requirement on public transport, in health and care settings, and in all indoor public places, with the exception of education settings and hospitality. And the aim of the government will be gradually to ease these requirements as the risk of coronavirus decreases. Finally, Llywydd, I turn to 2 further changes to self-isolation requirements. I much regret the decision of the UK Government to remove the requirement for doubly vaccinated travellers returning from amber list countries to self-isolate. The risk of re-importation of coronavirus from other parts of the world, and especially new variants, has not gone away. The removal of a defence against that risk, and especially at a time when the virus is in such rapid circulation is very difficult to understand. But because the vast majority of international travel to and from Wales is via England, it is, as our Chief Medical Officer says, untenable for us not to do the same thing. We will therefore remove the requirement for all adults who have had 2 NHS COVID vaccines and for under 18-year-olds to self-isolate on their return from amber list countries, and we will remove those requirements from the 19th of July. However, we continue to advise against all but essential travel abroad, and we continue to strongly recommend people to holiday at home this summer. I turn now to the position in relation to domestic self-isolation. Here, the Cabinet has decided that during the next 3-week cycle, which begins on the 7th of August, we will remove the requirement for people who have been fully vaccinated to self-isolate if they are a close contact of someone who has tested positive. There is still work to be done before these changes can come into force, for example, in adjusting our TTP system and putting in place arrangements for those who work in health and care settings. Self-isolation will continue to play a very important role in breaking the chain of transmission for anyone who has symptoms of the virus, anyone who tests positive, and anyone who has not had 2 doses of the vaccine. Llywyd, coronavirus has not gone away. Whatever the coming weeks and months hold, the simple measures which have helped us to keep us all safe throughout the pandemic will continue to protect us all. Keeping your distance, meeting outdoors, being in well-ventilated places, avoiding crowded places where possible, wearing a face covering where it's not, and good hand hygiene.
If we follow these simple steps, we can work together to keep coronavirus under control and prevent this 3rd wave from growing too high. All of the evidence suggests that new variants, which may not respond to the vaccines, are more likely to emerge when cases of coronavirus are at high levels. It remains vital that we continue to work together to keep each other safe and to keep Wales safe as well.